Hello everybody. As you might have caught in my June 1st video, there has been an update in my HHT condition. If you're unfamiliar, HHT is hereditary hemorrhagic tellengastia. I made a video about it in my health section. Right here's the video. And I will link to it below because I still don't know how to do an in-video link, so that was just a picture of the video. But linked below will be a video all about what HHT is, and it's pretty informative. I think I did a decent job explaining it. If it's not the best video in the world, at least it's pretty informative. But it is a genetic disorder that causes miswiring of veins and arteries in the body and various organ systems and on the skin and mucous membranes. About 4 years ago, I had 2 lung surgeries, one right before Thanksgiving and one right before Christmas, to repair arteries in my lungs. And they said there was a vein. Veins are not your arteries, they're the little blue ones that run all over. There was a vein in my lungs that was big enough for an adult male surgeon to have put 2 fingers in it. So that was very close to aneurysming. And an aneurysm is when there's too much pressure and strain put on an artery or vein, and so the walls become thinner and thinner and thinner, and it develops a bubble with very thin walls. And what this genetic disorder does is it connects improperly veins directly into arteries without the proper capillary bed, and that's what this is an example of, is how an AVM works. See how the second picture, it goes directly into from an artery to a vein without diffusing through that capillary bed. There's a number of things that happen with this, but also that's described in my HHT video. I won't get back into it, but veins are supposed to be low flow, which means not a lot of pressure, like a drip from a faucet. Arteries are meant to keep the high blood pressure flow, like a river. And when there's a direct connection, there's high pressure volume put in these tiny veins, and so they can't withstand the pressure of the force of the amount of blood that's supposed to go through a artery going through a vein, and eventually they expand and get thinner walled and can rupture. Now recently I finally had a follow-up. Apparently with this disorder you are supposed to have annual follow-ups. I didn't know. I've kind of stumbled my way through my own health care, and I lucked my way into an HHT specialty center 4 years later after having the diagnosis and having the 2 coil implants put in my lungs. Well, more than two places, 5 coil implants, both sides, upper and lower, and they put coil implants in there to cut off the blood flow in the part that is improper, and eventually, like damming up a river, the blood will find a different channel to go through. And so I had to have, when I went to the HHT center, they gave me an angiogram. I still need to have my spinal cord and my liver looked at, but they said that the testing I'd had previously on my head was not sufficient. You need to have a specialty center really do your follow-up testing if you've been diagnosed with this. But I had an angiogram from chest down to legs to recheck my lungs and check for blood clots, which can also be common in this condition, and check all the veins throughout my body. I had a brain CT with and without contrast, and some things showed up, which I do have a neurologist to the untrained eye, not looking for HHT, I had a CT where they inject dye into you, contrast dye, and they can see that that was clean. But it's not the proper test, and they didn't know what they were looking for because they're not a specialty clinic. So that told me that I didn't have any massive AVMs or anything. So I was going into the follow-up with the specialty clinic about this test, assuming that I had nothing going on. When they got the results back, my lungs are fine. I haven't grown any more tellengastia or AVMs in my lungs. However, my brain, something showed up in my temporal lobe, one superficial, which means near the front, and one deep tissue, somewhere near the back of my frontal lobe. And they're small, but they're not super small. The HHT pulmonary specialist referred me to neurology HHT specialist because they weren't entirely sure what it was, but I was reassured that it probably wasn't a big deal. Now, what I was assuming that this was after doing my own research, because I do a lot of my own research, you kind of, when you have bizarre and or mysterious medical conditions and disorders, you have to educate yourself. Don't Google doc yourself into anxiety, but you have to educate yourself and be your own advocate. From everything I'd read for my report, the brush-like appearance, etc., of the weighted images on the MRI, I assumed that it was a tellengastia. Tellengastia, as I explained in a previous video, is similar to an AVM. They're just very, very, very tiny. And that's also, examples of that is in the HHT video that's linked below. But I won't get into that very much. It's just like an AVM. It's just so tiny. And you can have those in your brain. And that's a watch and see kind of a situation. They're so small that they usually don't grow. They usually don't rupture. And even if they do, it's just spotty little bleeding. It's so tiny. The veins are, it's such a tiny vein structure that's not going to cause any major kind of damage or hemorrhage should they expand aneurysm, and then the next step after the aneurysm is a hemorrhage where the aneurysm pops and it bleeds out. However, the neurologist said that they weren't sure what they were, which took me by surprise. So I had found out that they could be AVMs. They could be these larger masses, and these larger masses could expand at any point and rupture. They don't work like he explained to me. That doesn't work like a tumor or a disease progresses linearly. Like it could be in 6 months, just they blow up, and you bleed out, and you hemorrhage, and you have a hemorrhagic stroke, or they grow small. We can never know. But if it's a AVM, it needs to be operated on, and he suggested open head surgery for the superficial one, the one up close, and gamma ray radiation for the one deep down. Gamma ray is right here. They use it for cancer too, and for some tumors, and it's for difficult to operate on, difficult to reach regions. They aim a ray into the location from several different angles and basically fry the vein. And the open head surgery would be open head surgery. So I may have AVMs in my brain. I'm still hoping that they are just tellengastia. He said, at your age, if we can get in front of them now while they're still small and they are AVMs, that's going to be greatly to your benefit that we treat them now with surgery and gamma knife. If they are just tellengastia, it can just be a wait and see, watch and see, keep an eye on it kind of a situation where likely I won't have to intervene in any kind of way, and it won't be a serious detriment to my day-to-day existence or a worry for my future, or require any kind of immediate interventions, and may never require interventions. However, in order to find out one way or another, we have to do a cranial angiogram. Now, a cranial angiogram is different from the other tests that I've had. It's similar to what I had to undergo when I went through my pulmonary surgery. They're going to take a catheter and insert it either into the groin, into the main artery in the groin, or into the main artery in the wrist. They cut it and they insert it into your main artery, not into a vein, into an artery. They sedate you. Hopefully, I'm going to ask them to sedate me entirely. And they run a catheter up through your veins, into your carotid artery, up the neck, and once they reach the top of the neck and the base of the brain with this catheter, then they inject the dye and they take images as the dye runs through your veins so they can see it release in real time. It's like they did with my lungs. That's how when they were operating on the one, when they injected the dye, they could see it bleeding out in the other lobe, in the other aneurysms, and knew they had to go back in and do another surgery. So I will be having to schedule this in the near future, to have an angiogram. A cranial angiogram is what it's called, and it is the gold standard to diagnosing AVMs, tellengastias, and other malformations of blood vessels in the brain. And he told me the risks and the benefits, and I was a little wary. However, the risk of letting an AVM go is worse. I'm still highly hoping and positive thinking that it's just a telengastia. But however, in order to know the diagnostic cost of letting it go, was assured to me would be more dangerous than finding out. And the gold standard for finding out is this test. This is a few pictures of what the room is going to look like. You get sedated and brought into an operating room. Your head is stabilized, and they run that catheter up a main artery, either in your wrist or in your groin, depending on, for a variety of reasons. I don't know where they're going to go in me, up into your carotid artery, and then when they get here, they inject the dye, and it goes through your brain, and they can time-lapse watch and see where it leaks or doesn't go where it's supposed to. And then they can see what's happening in those two areas in my brain, in my frontal lobe, and tell exactly what they are and what they are doing. And that will be the definition, the diagnosis for me to know what to do from here onward, which could be, again, wait and see, watch and observe, or I may need to have surgery or gamma knife or a combination of the two of them. And I still need to have my liver and my spinal cord checked. That is where I'm at with the HHT right now, and I'm sharing this with you because I already made an HHT video, and I wanted to let you know that if you've had previous exams of your brain by an untrained eye, even if they were of your veins and arteries in your brain, you need to have another exam because something was missed in mine, because my neurologist is not an HHT vascular specialist and he didn't know what he was looking for. Also, the gold standard for diagnosing differential diagnosis of malformations of blood vessels in the brain is a cranial angiogram, and it's not necessarily the funnest procedure. It takes about 45 minutes and about 3 hours of recovery, but it's more dangerous to let an AVM go. And make sure to do all your follow-ups. I have to sniff around a while to make sure that I get my liver and my spinal cord checked too. And they haven't called me yet to schedule this, so this is really new information for me. And when I do the procedure and I find out more, I will keep you all posted. Until then, find out more by watching the HHT video linked below, or going to hht.org. I'll also include the link to this below, because again, I don't know how to do an in-video link. And find out more about it, gather awareness, contribute to research, and be your own best medical advocate. If you have this disorder, you need to stay on top of it for you and your family. And wish me luck. That it's just tellengastia. Just the itty bitty guys that we just have to watch and don't have to pop my head open and do anything with. Because I'd really like to not. I'm intimidated enough just having sedation and having that procedure done in and of itself again. I remember the last time I woke up from sedation and 3 nurses had to hold me down because I didn't know where I was and I was very disoriented, but they didn't want me to pop the artery open in my leg, and I was just not cool. So that's what's in my future. Wish me luck. Magic 8-Ball says it's a tellengastia, and I'll keep you posted. Love you guys. Healthcare. Health is your most important asset. Take care of yourselves.